Hi, so I've got Hudson here. I'm going to be looking at the range of movement of the joints in his thoracic limb. So I'm going to come down to his distal interphalangeal joint, which, good boy, we can flex and extend. And each one of these separately. Good boy. I'm not going to do all of them because I know he has very ticklish feet. Then going to come up to the proximal interphalangeal joint, which can also flex, good boy, and extend, good boy. Flexion and extension. So if I wanted to double check that that was ticklish feet, obviously we could look at the other side. Moving up to the metacarpal phalangeal joint, I'm going to do these grossly in flexing and extending. And that's got quite a nice firm end feel there. Moving up to his carpal joint, we're going to flex and extend. He's got a lovely extension there with a firm end feel. And then we can go into a medial deviation and a lateral deviation. Then moving up to the elbow joint, we come up into a nice flexion, good boy, and into extension. So that's quite tight there, being limited by his biceps. We can then pronate and supinate as well. So moving up to his shoulder joint, come into a flexion and extension, good boy. Also with the shoulder, we can abduct and adduct and medially rotate and laterally rotate. Then coming up to the scapulothoracic joint, the scapula moves cranially and caudally and also dorsally and ventrally. Finally, to get the whole limb range of movement going forwards, we can go into a protraction, which has got a lovely range of movement there. And then coming backwards, the whole limb can move into a retraction. Good boy. So just coming in, we can use an objective measure for some ranges of movement. So I'm going to measure the flexion of his carpus. So bringing that into a full flexion there. And he has just under 40 degrees there. So that's a nice range of movement there. I wouldn't suspect any issues. So in conclusion, I would say Hudson does have some tightly ticklish feet, but I would double check with comparing to the other side and with the owner. He appeared to be slightly restricted by soft tissue going into his elbow extension. And finally, one thing I noticed was maybe not quite so much mobility around that scapula, so I'd also compare to the other side to see if that was normal for him. So, thank you.